One of my pet peeves is when I see a patient who comes to me for a clitoris reduction, usually they've had at least one of the wrong surgeries done before. So in this video, we're going to talk about my top 3 tips to make sure that if you do need a clitoris reduction, you're getting the right surgery and not just a clitoral hood reduction or a labiaplasty. So tip number 1, when you're communicating with your doctor, never be afraid to use pictures and diagrams. Maybe like this diagram down below, so that, for example, if the glands of the clitoris or the length of the clitoris or the actual clitoris itself is too big, you can sit with your doctor, point to this and say, is this getting reduced? Not just the labiaplasty, not just the skin over the clitoris, such as a clitoral hood reduction or the labia minora, although oftentimes people need that combined, but this part, is this going to be reduced? That's my first tip. Tip number 2 is you really need to be dealing with a specialist. The vast majority of plastic surgeons do labiaplasties and clitoral hood reductions very well. These are technically much more simple procedures. They don't really involve an in-depth knowledge of the anatomy there, but there are very few surgeons in the United States, for example, who will do a true clitoral reduction, because you have to be very specialized and very familiar with the anatomy down there. Tip number 3 is the length of the procedure. A true way to tell whether or not you're getting the right surgery or not depends on how long it's going to take. So typically a labiaplasty or a clitoral hood reduction would take me about an hour, give or take. A true clitoral reduction takes me between 2 and 3 hours. Usually I'll be doing a labiaplasty and a clitoral hood reduction at the same time, but it's a much more involved surgery because we have to remove the erectile tissue. So we have to, in a way, deconstruct the clitoris, making sure we keep those nerves intact in there, and then arrange everything, make it pretty, lift it, usually decrease the head of the clitoris if that's what the patient wants, decrease the length of the clitoris, and get rid of the extra erectile tissue so it doesn't get so big.